At the federal level, many billions being allocated towards solving the post-crash care problem. The National Roadway Safety Strategy. There was an announcement that I'm thrilled to say, were named an ally in action by the Department of Transportation.
Okay.
We were actually the top company featured on their press release about
Congrats.
this. So thank you. It's been really exciting.
Welcome back to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster, with my esteemed guest here, Jonathon Feit, CEO and founder at Beyond Lucid Technologies. Jonathon, great to see you.
Always good to see you.
When I think about you and the work that you've been doing for many years, how long have you been doing this company?
Oh, God help me. We're going to have 15-year anniversary
15 years,
year.
okay. So you're
15 years.
15-year overnight success.
We're a teenager.
Yeah.
Bonafide.
Okay, so when I think about your work, I think about, because we've had many conversations, I think about a car accident. I think about someone's in a car accident and EMS arrives and they have no idea who they're about to treat. So maybe the standard treatment, EMS arrives and it's just a black box, a mystery, who is going to be there? And then I think about what you've built with Beyond Lucid, really trying to change that incredibly potent moment scenario of knowing what's going on. So kind of take us to a car accident, and like...
Thank you for that. Powerful lead at a powerful time. So there is something now recently announced in the last year or so called the National Roadway Safety Strategy.
Okay.
So at the federal level, many billions of dollars being allocated towards solving the post-crash care problem.
Okay.
Incidentally, about a week ago, there was an announcement that I'm thrilled to say, were named an ally in action by the Department of Transportation.
Okay.
We were actually the top company featured on their press release about
Congrats.
this. So thank you. It's been really exciting. We're certainly not, there's about 130 or so companies that have been announced so far around different aspects, right? Some are stopping crashes, so you've got really intelligent driving systems. You've got some that are notification systems to the driver, like, hey, there's construction on the road, move over, right? And in our case, there is actually one of the 5 pillars of this National Roadway Safety Strategy features an ambulance. So there's a really important focus at the federal level on down on this scenario. So your timing for the question is really apropos. We try to make this even more emotional. So imagine you show up at the scene and there are 2 parents and there's a kid in the back seat. The parents have been knocked out because of the collision, and in the back seat is a kid who's crying. And responders show up, they take the kid out of the car, and everything's great, and 5 hours later the kid's dead. Because they didn't know that the kid had hemophilia. For example, everything looked fine, but internally they were hemorrhaging, right? So that type of scenario is actually, for us, it's the magnum opus. It's the culmination of 15 years worth of work.
How do you solve that problem?
Yeah, it's several different, actually AI has a really important role to play in this. So I've been talking a lot about this. Just think about, in that one scenario that's truly split-second scenario, you need to be able to know who is likely impacted by the vehicle, where their health information is, validate their identity, pull that information in, filter it down to the point where a responder arriving on scene who needs to know how many units need to be deployed, right? Because if you've got, for example, 2 parents and a kid, or maybe 2 kids, or 5 kids in a minivan, how many ambulances need to show up? How many engines are there? Are people conscious, right? Is someone bariatric and needs to be lifted out, especially if they have a mobility issue, right? All of those pieces of information need to be consolidated. And so what I find fascinating about our American healthcare system is all that information exists, or most of it anyway.
Okay.
But it's in different places.
Yeah.
So the ability to crawl an ecosystem and pull back not raw data, but synthesize, actionable in seconds, right? And this is where there's a really fascinating debate we can talk about today or another day on our next video segment. Same bat time, same bat channel. About how much information is needed, right? There's a lot of question around, if you give me everything I need to know, or give me everything, or give me what I need to know. And how do I know what you need to know if you're a different clinician in a different place? Yeah. And so I think
too much information can be a problem.
Well, again, if you've got 30 seconds to figure out what to do, you can't look through 20 years worth of electronic health records to find that kernel of information. Yeah. This is a very robust discussion in the EMS mobile medicine profession. Certainly in California. California just on January 31st launched what they call the statewide data exchange framework. Okay. It is in law. It was established a couple years ago and it just went live. And it establishes a statewide health information ecosystem for information sharing. It is a very active question of who needs to know what. Yeah. Because the information that the hospital or your mental health clinic or your rehabilitation facility needs to know is quite different than what a fire service arriving in, to the convention center in Los Angeles needs to know.
Sure.
So how do you take that same body of information and slice it for the correct clinician? And that language has been lacking. There's been a lot of folks who have said, I need to know, but they haven't specified what they need to know. And so when you look at FIRE, F-H-I-R, not F-I-R-E, right? Big part of the conversation, give me only what I need, not everything.
Who decides what the EMS professional, what the EMTs are going to get in that moment? Like currently, where's that conversation?
There are standards for that.
Okay.
Yeah, so again, they're siloed, unfortunately, but they're coming together. The Office of the National Coordinator, who I have been very vocal in my praise of, I think they're doing an incredible job in helping to quarterback that conversation.
Okay.
In the EMS world, for example, we have the National EMS Information System, which is a function of the National Highway Traffic Safety Administration. There's a separate system in the U.S. Fire Administration, which is in FEMA at the federal level, called the National Fire Incident Reporting System. That's actually being sunset to make way for something called the National Emergency Response Information System, or NERIS, and that is designed to be interoperable. So give me what I need and not more than I need, but make sure that I can, again, find in the ecosystem. So the answer to your question is these pieces come together, and the standards exist, but they didn't talk to each other.
Yeah.
And you know from knowing us as long as we've known each other, for me, I think convergence is the name of the game, right? The reality is no one way to do this is correct, and especially in an emergency like a car wreck. You need all of this, right? You're going to have fire show up and EMS show up. You may have air transport show up. Right? They're regulated differently. They have different masters, if you will. They bill differently. Their operations are different. You may have linguistic challenges. AI is another example, really great at translating things really quickly. So if you have, and even into writing, so if someone is visual, has deafness, for example, that you can communicate with them. So there's a really powerful case to be made in that one simple example that you gave of a car crash every day. How many of these things combined, these pieces of information, could make the outcome of that so different that people walk away. And I've said in my first interview, I think with Startup Health many moons ago, what was so exciting about our work is that the product is somebody walking out of the hospital, right? It's not a widget, it's another day, right? And Halcyon Post-Crash Intelligence, the tech that you alluded to, this post-crash encounter, our tagline is, here's to your beautiful tomorrow. And that's really it, right? This idea that if I just got to chill talking about that, combining all these streams of things, and if it works as it should, you get to go home.
That's a good segue to talking about Beyond Lucid. We've outlined the challenge, and you can kind of place yourself there, and you're like, well, what has to change for that scenario to actually be different? So what is Beyond Lucid doing today to address that problem?
We are doing those things. So
change the scenario and insert Beyond Lucid.
So we provide in that scenario, as I mentioned, Halcyon Post-Crash Intelligence is really about ensuring that the responder arriving on scene has access to that information.
And that's your platform,
That's
Halcyon.
our technology, beyondlucid.com/automotive. So funny, I don't know if Startup Health knew that it had an auto tech company in its space. In fact, Unity and I years ago talked about the car as a healthcare platform. This is kind of in that vein. So we, over the years, have built out pieces of this technology, the pre-hospital pipes, if you will, the fiber optics to connect emergency services with their ecosystem. We built a registry around end-of-life orders, children with special health needs.
So that when you're in the ambulance, you can actually access the data from there.
And again, I think I've really, not to sound pandery, I really mean this, the Startup Health ethos has sunk into me in this way, that the mindset we've tried to take is about collaboration, not trying to own an ecosystem. So a number of years ago, working with Steve and Polina, with the team at the time, was trying to help understand and put into words this idea that if I'm not going to own the ecosystem of every patient care record that's out there, how do you do this, right? Where any community you go into, and it turns out sharing with others is a pretty powerful way to do that, right? So detaching the proprietary, saying you don't have to use my record system, as long as those standards are abided, I can take in the data and I can share the data. So you have someone whose focus is on collecting the data, someone whose focus is on sharing the data, someone else whose focus on analytics, for example. And it's part of an ecosystem which has allowed us to be in 33 states to date. And it's not because every place uses all of our tech. Our mission has never been to be all things to all people, but to be able to offer something for everyone.
Okay.
Because they all have a gap to fill. And if you've got enough tools in that Swiss Army knife, so to speak, you can use a tool or two or three in combination with what they have, which really eliminates the conversion cost that is such a barrier to healthcare adoption, right? I have this system, I need a new one. That presents a hindrance. If you're able to say, I'm going to augment what you have, keep what you like, enhance what you don't.
I love it. I love it. So to take us back to the child in the back seat with hemophilia, it makes sense to me that it'd be manageable to empower the EMS with a medical record on the way. You know, you're extending from the hospital out to
selections of it.
Yes, selections of it. Yeah. But how do they know who's in the car? How do you take it to that level?
Great question. So again, there are a number of ways of doing that. There is a probabilistic effect in a car wreck. So the current status quo is you arrive and you know nothing. Right. So imagine a scenario in a HIPAA-compliant environment where I'm able to say this vehicle or the phone, for example, that's in the vehicle, or the person who said to an Alexa, for example, Alexa, I've been in a crash, send help. And that information can get relayed to cloud-based architecture, for example, or a proximal if you don't have network in a rural environment, they show up. And that identification can show, here are the people who are registered, for example, to this vehicle.
Okay.
And because it's in this emergency HIPAA-compliant environment, I can show Logan's face, right? And you can confirm quite quickly, is this Logan? Is this his kid? Is this his spouse? Right? If you're not there, go to work, do what you would do anyway. Right? But there is a really powerful algorithm, too much to get into now, but there's been really compelling research around time to trauma, or time and trauma to definitive care, right? So for every second that I can save identifying what the actual underlying issue is, the survivability goes up, right? And the converse is true too. So if I'm able to say, because I know what you look like, what information you've registered in the system, and I can use that to pull in data from the HIEs, from the rest of the ecosystem, I can inform a responder, and even saving 30 seconds, or avoiding an error, right, by getting you the right blood type, or making sure that your allergy is abided, getting you to contacting the right clinician who can stop an incorrect procedure from happening, like a surgery you might not survive, right? That identification, the bar is actually pretty low, because today you don't have any of it. So even if I just show your face and a couple pieces of information, but once I can confirm who you are, I can start to bring in more information. So as we start having inward-facing cameras, for example, facial rec is completely possible, right? If you're registering into a car like a Tesla or a more modern vehicle, right? The car knows who's in it, right? It can adjust the seat accordingly. You're tied to your phone, or your phone is paired to the car. So there's a ton of work that's being done on identifying who's in that vehicle. And there's even more now with things like substance use and trying to avoid drunk driving. So do you have, do you need to use a breathalyzer, right? All of these pieces of information help to shorten the window to identifying that person. And then our role is, once I've identified that, how can I serve up the right information immediately?
Do you feel like you're at an exciting inflection point in terms of the acceleration of adoption of basically smart cars getting smarter and smarter and smarter? I mean, is this going to play into this?
It's a great question and a really important health equity one, actually. So, which is not something folks think about a lot in this vein. Yes, it does. A lot of those tools are embedded. But one of the things that the feds have done in a very important way, and it's filtering down to the states and the municipalities too, is recognizing that the average lifespan of a vehicle on the road now is 12 years. And there's a lot of people who buy used cars. So that's why when I mention things like Alexa, for example, Alexa's embedded in a lot of vehicles now and other, cloud-based sort of interfaces. But it also turns out that Amazon, for example, sells an Alexa attachment for like $20 that you can buy on Amazon, right, and plug into the cigarette lighter, or you can use your phone, and most people have a phone. So yes, the speed towards intelligent cars accelerates an expectation that this is there, I think. But even so, advanced driver assist systems, or ADAS, are really focused on keeping a car from happening. We still haven't gotten to a point where crashes are avoidable, right? If someone in a disconnected, not smart vehicle, a dumb vehicle, I guess, drives through a red or is drunk, we haven't solved that problem yet. Those are pretty
Yeah.
fundamental problems. I was actually just at CES this past year. For the first time ever, I saw a car that can move horizontally. I used to say cars can't move out of the way, right? So if you're stuck in an intersection and someone plows through, you're going to get hit because you can't move out of the way. Imagine a scenario, which is coming, which Hyundai built it, where you can move, the car will swing out of the way of the vehicle that's arriving. I mean, that's amazing.
Wow.
Right? So it's a really strange thing to say our goal in working in emergency services is almost to put ourselves out of business.
Interesting.
Right? If everybody's safe and everybody's healthy, I don't have a job.
Yeah.
So we've got a long ways to go to get to that being a common reality, because at the same time as they're getting smarter, there are more people buying vehicles that last longer.
Yeah.
So people are buying cars that are 10 years old and keeping them, which means we still have this lag effect of those folks don't have the benefit of all the new stuff, but they still need to be protected. And in many cases, they need to be protected more because they don't have health care, right? So all the things that this community is taking care of, the health disparities issue, that's where they live, right? That's where the problems are. So our view, and it jives with the emergency medical services, is how much of the EMS community takes care of the safety net, right? The safety net are the folks who have the older vehicles, and then they don't have the resiliency to know that their health care is going to be covered. And the Federal Safe Streets and Roads Initiative is actually keenly focused on people who walk on the road or take a bike on the road because they don't have a car.
Yeah.
So I think your question is very prescient, but it's really interesting how much the focus on post-crash care has started to tie in with this question of health equity.
Interesting.
That's not association I think most people would think, but it turns out to be a very fundamental question of, I live in a rural environment because my kid has a disability and the fresh air does them well, and I can't afford to have a job because I need to take them to the doctor, which also means I have to drive more to get to where I do have to go, which makes me more of a risk on the road. And if something happens, I'm further away from a trauma center, right? And these threads kind of circle on themselves.
Yeah.
We are putting ourselves right in the middle of that. To say, if I can disrupt that crisis, there's it was amazing, 36,000 or so deaths on American roads every year. And according to the Department of Transportation, they need solutions.
Yeah.
Those solutions happen to live in the emergency medical services arena and fire and public safety medicine. Which
And
is
now in the auto industry.
The auto industry. And people are starting to say, we have recognized the problem. We didn't know the solutions could exist because they're so siloed. But it goes back to that convergence and this idea that if you've got healthcare, health data, interoperability, speed to communication, right? That infrastructure is really important in there. Then you can actually make a real dent in that. And that 36,000 or so is people who died. That's not the number who were injured. Perhaps, sorry, I don't know if this is the right place, I apologize. But people who have lifelong injuries and handicaps and so on because of that collision. Imagine if you could get them faster to the right place. Maybe you will have a lifelong improvement on their prognosis. It's a real reverberating problem. And by the way, it's huge globally. Talk about TAMs and things like that. So fun, maybe closing fact, not so fun. According to the World Bank, India has 1% of the world's cars and 11% of their roadway fatalities.
Wow.
When you think about that, right? And I've talked to people about getting this type of solution into places like India, and where we collectively have a long way to go is the answer that they gave me, some very smart, entrepreneurial, connected people, was death on the roadways is seen as a cost of doing business. Like, that's a real thing. When I got some statistics from Comcast, right? Big Comcast. As of a couple years ago, 5,000 crashes in their branded vans every year. Right? These are real numbers, right? With real liability cost. There's people who get affected, and the idea that people even at the federal government, their answer was, we don't know how to solve this.
Interesting.
That's where this ecosystem can step up, I think. And we're starting inserting ourselves in it.
Well, I love that you are bringing that collaborative mindset to this whole ecosystem.
You guys.
You're bringing the data in, and embracing, it takes humility to say, like, we're a partner. And we're not going to own every piece of it.
Can't do it on your own.
So
too big.
If we had more time, we could dive into more trends of what's going on. I know that you give this a lot of thought and feel it very deeply. You've been going at it for 15 years, grinding and really bringing a lot of help to a lot of people. So I appreciate you sharing with us today.
If I can just say, I mean, it's something that especially now we keep in mind. Our company, and particularly this, is really dedicated to my business partner, Chris, who is, of course, been involved in the Startup Health family since the beginning with me. His father and sister were killed in a car wreck near the Four Corners of New Mexico. And so to us, this is sort of a grand, dark serendipity, right? But we owe it to them, right? My ability to work with him is unfortunately, like, his trajectory of his life brought him to here after that disaster happened. Yeah. So it's something that really, you guys would talk all the time about the mission and the why. It's a pretty compelling why when you are able to say, maybe we could have helped.
Yeah,
so,
yeah.
Anyway.
Well, thanks for sharing the story. 15 years. Well, I think you'll be at it, for many more. And
gets you up in the morning. That's for sure.
Yeah, that's great. That's great. So thanks for coming by and giving us the update.
Thank you, Logan. Appreciate it.